Greetings. Today we present a few techniques to aid with robot-assisted partial nephrectomies for complex renal masses in solitary kidneys. Among the various factors which determine the outcome of the surgery, only a few of them are modifiable. As opposed to main renal artery clamping, selective clamping involves isolating and clamping only those renal arterial branches that directly supply the tumor. We present the case of a 43-year-old gentleman who had already undergone right radical nephrectomy and presented to us for management of his contralateral mass. CT shows two enhancing masses in the lower and the mid pole, which are supplied by the lower pole lobar branch of the distal renal artery. Hilar vessels were dissected free and slinged as the first step. The tumor was then scored with the help of an intraoperative ultrasound. The lower renal artery was then selectively clamped to restrict the ischemic injury to the area supplied by it rather than the entire kidney. The same was confirmed by injecting indocyanine green dye and visualizing it with the help of Firefly. The tumor was then resected along the scored margin. Sliding clip rhinography was then performed in 2 layers using V-lock suture. The final vascularity was again confirmed using Firefly. Histopathology was clear cell RCC and the patient is tumor-free at 1 year. Taking it further, superselective clamping involves anatomic microdissection of tumor-specific segmental arteries up to the tertiary or higher order branches in order to completely eliminate ischemia of the remnant kidney. We describe the case of a 55-year-old patient with a right upper polar renal mass and a small non-functional left kidney. Thorough analysis of the CT angiography showed that there were 3 renal arteries, out of which the uppermost one was exclusively supplying the 9 cm enhancing mass. After bowel drop and cauterization was completed, the hilum was dissected and the vessels were slinged for rapid control in case the need arises. The tumor was then scored with the help of an intraoperative ultrasound. We then proceeded to selectively cut only those vessels which supplied the tumor. The tumor was then resected off clamp. As would be expected, slightly more bleeding was encountered. Sliding clip rhinography was then performed in 2 layers. The tumor was oncocytic neoplasm with undetermined malignant potential, and the patient is tumor-free at 1.5 years follow-up. Hilar masses are particularly challenging. The anatomy-based crown technique protects the large hilar vessels and minimizes the tension of suturing the defect. We describe the case of a 43-year-old gentleman incidentally detected to have a right hilar renal mass. We noted dual renal arteries and triple renal veins and a 4 cm enhancing hilar mass abutting the duodenum on CT angiography. After cauterization, the renal hilum was dissected. Intraoperative ultrasound was used to mark the tumor. An additional port was placed and Satinsky clamp was introduced to clamp the vessels. Resection of the tumor was then carried out. Crown rhinography uses uninterrupted suture that covers all layers of tissue. This suture begins in a retrograde manner from the hilum towards the parenchyma. Each stitch follows the contours of the major blood vessels and is fastened with clips onto the renal capsule, creating a closure that resembles a crown. Facial layer is approximated over hemostatic agents. Histopathology was clear cell RCC and the patient is tumor-free at 2 years follow-up. A necessary prerequisite to any partial nephrectomy is rigorous planning. On evaluation for backache, this 48-year-old gentleman was found to have a solitary right kidney with a renal mass. Painstaking analysis of a CT angiography and 3D reconstructed model showed us a 10 cm enhancing lower polar mass surrounded by multiple vascular collaterals. Dual renal arteries and a single renal vein were noted. The hilum was dissected and the vascular structures were slinged. The margin of the tumor was demarcated using a drop-in probe. The lower renal artery was selectively clamped, and the same was confirmed using Firefly. Resection of the tumor was then started. The feeding vessels were carefully clipped and divided, and resection was thus completed. Sliding clip rhinography was performed in 2 layers. Adequate vascularity was confirmed at the end of the procedure. Clear cell RCC with focal sarcomatoid differentiation on histopathology. In the realm of NSS, meticulous forethought gives the best chance at success. Various innovations such as selective clamping and modifications of rhinography can help reduce ischemia time while dealing with complex renal masses. Thank you.